this group came together to make sure that I was going to get through the program. I think it's why I can't leave this place.
Hello, everyone. Welcome to the latest episode of the current Touro University, California's Alumni Podcast. Joining me today is Niki Anudokem. She's a 2024 graduate of the joint MSPAS MPH program, which is in the College of Education and Health Sciences, currently working as an internal medicine physician assistant with Solano County Family and Health Services, and also serving as an adjunct faculty member here in the joint program, the joint PA-PH program. So, Niki, welcome to the podcast.
Thank you.
Just for those of you who are familiar with the podcast, we normally record in the Social Justice Resource Center. We're recording today in the Great Room at Wilderman Hall. Some of you may recognize the backdrop here, the fireplace in the Great Room. So welcome, and thank you for joining us today, and thank you, Niki, for being here.
Thank you for having me.
So why don't you tell us a bit about your life story prior to your time here at TUC, just to kind of set the stage and introduce yourself to folks.
Yeah, so I was born in San Jose. I was there until about 7, and then I moved over to El Dorado Hills, which is kind of by Sacramento. I was raised there, and then as soon as I turned 18, I made my way back to San Jose.
Great.
I went to San Jose State for my undergrad, and then here for my master's.
Okay. Yeah. So when did you become interested in the healthcare field? Kind of what led you into healthcare?
Yeah, so I was born to immigrant parents. So my parents are both born and raised in Nigeria. And at least with Nigerian culture, it's very common to go into engineering, medicine, law, or something in STEM. So to be honest, there really wasn't a whole lot of options in growing up. And then I have 2 older sisters, both in medicine. One's a nurse, the other is a doctor, and my mom, who was a pharmacist. So I just have kind of been surrounded by medicine.
Okay.
So medicine it's like it runs in my blood. But I would say I really kind of got a big interest in it when I took my anatomy physiology course in high school. I think that was when I had an interest, but I also recognized that I was also good at it too. And I think that was when it really kind of clicked. Like, I think I was resistant for a long time, kind of like when your parents tell you need to do something and then you don't want to do it. I think I was resistant to medicine just because it was what I was expected to do. And then I realized I like it and I'm good at it. So here I am.
Well, that's great. And then what led you to the path to becoming a physician assistant? I mean, you've got a pharmacist and a nurse, right? A registered nurse and a doctor, if I heard you correctly?
Yeah. So, I mean, I kind of got to see it all and pick and choose. Don't want to do that. Don't want to do that. But no, I knew how long the MD route was, and I knew very early on I definitely did not want to be in school for as long as an MD, but I also knew I wanted to have a bigger role than an RN. So I kind of off the bat knew that those didn't seem like what I wanted. And then my mom being a pharmacist, I mean, she really pushed for me to do pharmacy, but it's just chemistry and math and just 2 of my biggest icks. So I honestly just ended up doing a lot of research and just figuring out that there were more roles than an MD, an RN, and a pharmacist. It took work, but ultimately I had to do homework and recognize that this is capturing all the parts of medicine that I want to be able to accomplish, and I was able to find PA.
Great. So you talked about the research that you did. What kind of research did you do that kind of answered those questions for you? Because that may be helpful to people thinking about, what am I going to do? I like healthcare, but I'm not sure what.
I mean, like I said, having sisters who were in those 2 fields really kind of gave me a good idea of what I did not want. I think that was the most helpful thing, is I do not want to be in school for this long, and I do not want to, these aren't the roles that I want to be responsible for. So I think for me, the number one thing that was important to me was how much flexibility that I had in my role, and how much I was able to actually provide care to a patient. And not only that, I also really wanted to be able to prescribe medicine. And there's just not a whole lot of, there are a lot of roles in medicine, but there aren't a whole lot of clinician roles where you can prescribe. So that kind of narrowed it down quite a bit. But I definitely think it started off with really what I did not want to do. I would say that was, I think it can be kind of daunting to start with what you do want to do, because many professions do a lot of the same thing. So yeah, what was helpful for me was being able to narrow down what I in fact did not want to do and what I wanted to be able to do. And I was kind of, I found with a mid-level, which is NP and PA, and landed with PA.
Okay. And why did you choose Toro?
Toro, many reasons. I think, so one, of course, the dual masters. I definitely wanted a master's in public health. And I actually, that was something that they asked during the interview, is if you don't get into our program this time around, what do you plan to do? And I had actually said I plan to go get a master's in public health. So I always wanted a master's in public health, just because in undergrad, I majored in psych, and I also minored in public health, so I got a great idea of how important public health is in medicine, and that it's not universally taught in medicine. So I thought that was really important, and I thought it was really great that they integrate it in their curriculum to have public health. And so that was honestly number one. And then, of course, I'm also from the Bay Area, so I did want to be able to be local, and that was, at least Toro, California allowed me to do that as well. So.
Well, great.
Yeah.
So tell us a little bit about your general experiences here while you were going through the program, kind of the bonds you made with the members of your cohort, your professors.
Oh, man. I love it here, obviously, which is why I'm still here. But, I mean, it's imperative. You really, I don't want to say you can't, but it's very difficult to get through PA school, at least, a dual master's PA program, without your peers and without your faculty. And I would say, the fact that we are, I believe, anywhere between 48 to 50 students per cohort is super helpful, because it allows us to really get to know each other very intimately. And that goes for faculty as well. They know you very intimately. They know your strengths. They know your weaknesses. And I think that was something that I don't know if I would have been able to get through the program if it wasn't for the bond that I had created with my peers and the faculty looking out for me. Trauma bonding is very real. Trauma bonding is very real. It is traumatic.
Well, I've heard from alums in the PA program, but also some of the other programs as well. These are not easy programs. These are intense programs that have potentially life-altering consequences for the people that you're serving once you're out and living the dream, as it were. It's hard to get there. Absolutely. And I've heard the term trauma bonding before from other alums, and the kind of like the fast friendships that are formed in that crucible.
Immediate friendships.
It's a 33-month program that is basically nonstop.
Yes. Yep. Yeah. From the moment you get in till the moment you get out. I mean, it's constant. And the amount of learning that you're receiving, or the amount of information that you're receiving in such a short period of time, I think they describe it as trying to drink water out of a fire hose. Is similar. It's typically how they'll describe it, where it's just info being thrown at you, and you're trying to get as much of it as you can. And it's tough, but it's doable. People do it. And that's how I got through PA school, is reminding myself people do it, because people do.
They do every year.
Every year. I did it, so here we are.
You've mentioned to me before in conversation, and I know you've touched on it at least on your Instagram page and stuff, that you hit a bit of a rough patch while you were going through the program here. Do you mind sharing a little bit about that and how you're able to push through?
Absolutely. So my mom passed away in my first semester of PA school. She was diagnosed with breast cancer back in 2019. And in the beginning of 2021, it had spread to her brain, so she really had a quick decline. And right about when I started, she was put on hospice, which was about September, October. And by December, she was gone, December 17th of 2021. So that was a very difficult time, and it's actually it's always funny when people ask about my experience in PA school. It's very unique for me because for me, yes, PA school is absolutely difficult, but the trauma of losing my mom was much harder, much harder to deal with. So for me, PA school was actually very much a release from what was difficult, which was my personal life. So yeah, I think I share this story pretty regularly just because I think it helps people recognize that they can get through the program despite having challenges. It's absolutely doable, but it requires, again, those bonds, making sure people are looking out for you. And another thing that I share with people, this was during, I think, orientation or, one of the first day of school activities. And we had come together as a group, and it was my program director, Joy Moverly, as well as some of my colleagues, and we were just talking. And at one point, she had shared with us, I'm your program director, I'm here for you, open door policy, whatever you need. And as the activity was coming to an end, I had actually approached her, and I just let her know, hey, my mom's on hospice, she's going to die any day now. I don't know what to do. I don't know how I'm going to do this, but I want to do this, and I just know I need help. And I just was very candid and transparent, and she said, okay, I got you. I will look out for you. And they did exactly that. So very grateful. I mean, yeah, it's very emotional because it's not, I mean, yes, of course, losing my mom, but
Right.
just how much that I, I really have come to fall in love with the people here, and I think that I want to say it's reciprocated because they brought me back. So
Well, I mean, empathy is important in healthcare.
absolutely, absolutely,
You gotta be able to you gotta be able to connect with your patients.
yeah,
And my experience here at Turo is similar to yours, not losing someone as close as my mother, but, just the experience of they'll have your back.
yeah.
If you've got something going on,
They'll have your back.
they'll
They
have your back.
really recognize what it means to like real life. I think that that's something that I really appreciated is they are candid and they're open, and all of them will talk about their own personal experiences. Hey, I have stuff going on, because the reality is like we're not going through school in a vacuum. There is still life happening around us. So just being able to acknowledge and recognize, hey, things are still going to happen, and we're going to be there for you regardless, I think was huge. I had a few people that had gone to different PA schools, and I discussed some of the, extensions that faculty would allow me to have, or just open door policy again, where I can come in and just sob for a few minutes. And I'd be very honest, like I don't need anything more from you than a safe space to sob, and they gave me that, and that's it. And I just, there were quite a few people that I had spoken with who were at other PA programs who would discuss, not having any of that empathy for similar traumas or similar, circumstances, death or illness, whatever, and just being met with such resistance and, well, tough luck, and that just was not my experience here, and I'm very grateful for that.
Great.
Yeah.
So we hear all the time, and the pandemic really drove the message home that our healthcare system, if it's not overtaxed, it's right on the edge of being overtaxed, that all it takes is a nudge to push us into that state of affairs. So what advice would you offer to anyone who's thinking of applying to the program here at TUC in terms of, recognizing that it can be a little harried at times?
Yeah, so I would say get comfortable with the idea of taking out loans. Given it's a dual master's, so cost of attendance is going to be substantially higher than, your single PA program. So I think the idea of taking out loans can feel very daunting, but know that it's universal. I mean, I don't know if I can think of a single person in my class who didn't take out some amount of loans. So it's incredibly common. And that being said, given the career that we're going towards, and you will be reimbursed appropriately, and it'll just be a moment in time where you do have some some loans and you have some debt to your name. But again, that's why you're here. That's why we go to the program. That's why we get our degrees, and that's why we get a good job. And again, for all the people who have gone through this program that I have spoken with anyway, their loans are paid off, they're comfortable, and you worked hard for the money that you earn. So I would say it's daunting, but it's very, very common to take out loans. So be comfortable with that. I'd also say consider work study. So that's, working, but being paid through the school. And I say work study opposed to trying to actually find a job outside of the university, because it's incredibly demanding, and really just not feasible to try to work, say if you were an ER, a paramedic, or if you worked in the ER, something like that, trying to pick up that position while while being in the program is not feasible. However, they have work study positions like tutoring or working at the library, something where they can work with your schedule as a student and prioritize you being a student. And then you can still have a little bit of compensation as well. So I would say that's another option for people who, may not want to take out as much loans and may want to just have a little bit of income, work study. You can also apply for EBT, so that's for low income. You can have stipend or money that comes in to help pay for groceries and other, mostly groceries for EBT. So I know these are some of the things that were done, at least I know within my cohort. But again, I just can't emphasize enough that it's temporary and that it's why you're going to school. You will have, a comfortable living, and it is very much just a step in.
You're investing in your future.
You're investing in your future, exactly.
Yeah. What advice do you have to current students? The groups that are here right now, at the end of this month, we're going to have the white coat ceremony for, I think, the class of 2026. So they're finishing their didactic stuff here on campus and getting ready to go off for their rotations. Obviously, another cohort that's just starting their didactic.
It's crazy how quickly. I'm old news now. I'm class of 2024, and that's old news. I would say, lean on each other. Like I mentioned, trauma bonding is real for a reason. You will need each other. I think that not only with each other, but of course with your faculty as well. I think it's just like I shared my story, something that I make sure to let people know that are going through tough times is be proactive about it. Let them know sooner rather than later. You can request an extension on an exam or an extension on an assignment, but you can't unfail an exam that you've already taken. So, I would say if you have anything going on, no matter how small it might be, tell your faculty. Of course, talk to your peers. They'll be there for you, but faculty absolutely should know, because I really do believe that they look out for you for that reason. I think that's something that was an issue here and there with some of my colleagues. I know, if there was an issue coming up and they've taken some exams, they failed some exams, and then trying to go back and say, hey, I have this going on, I need help. And at that point, you've already taken exams, you've already failed some things, and now it's a little bit hairier to deal with. So proactive. Again, I told Joy before school had even started, I just dumped all that on her and she took care of me. So that's what your faculty are there for. Make sure to lean on them and make sure to lean on each other. And I would also say, remember your why. That's something that Cassandra, one of the principal faculty of the PA program, she says that a lot. When you're feeling lack of motivation, or you're just questioning what I'm even doing here, because you will question that many times. Why am I even here? It's so important to remember your why. Why am I here? What am I doing this for? Why did I come into this program? And your why can change, but remembering it at its core and remembering the passion is so critical, because the motivation won't always be there. But if you can remember your passion, I think that's key. So that's
wonderful. Yeah, it's wonderful. Now, taking this thread a little one step deeper, you're a working physician assistant now, new to the profession, but you're coming at it pretty close post-pandemic.
Yeah.
Your education happened starting with and trailing on the backside of
Yeah.
it. Things are different now in many fields than they were prior to the pandemic. So what advice, I know it may seem presumptuous to offer advice to your peers when you're new to the profession, but from that perspective, as somebody new coming into the profession, what advice would you offer to peers who are new in the profession and maybe even a little more experienced, just things that you've seen along your journey that you think could benefit even more seasoned PAs?
To that I say radical self-care. I think above all else, I think it's a bit ridiculous to expect our clinicians to be able to take care of patients if they aren't taking care of themselves. So I think what I have seen, something that I saw abundantly on my rotations, was burnout among providers who had only been in practice for a year or two. The burnout was so prevalent, and you ask, what are you doing for yourself? And it's like, myself? I don't have time for myself. Do you see all the patients I have to see? Do you see, I have to go home, I have kids, and that's how you burn out. So I would say radical self-care, whether that's being intentional about having time off. If you have PTO, actually taking the PTO. Don't let it, stack up for it to just kind of go to waste. Make sure that you're actually taking the time off that you're being allotted. I think that's more than anything, making sure that you're taking care of yourself, making sure you're taking care of your body. The things that we're, preaching to our patients, I think we need to be taking into consideration for ourselves. So that means drinking water. I can't tell you how often I've gone up to a preceptor or a colleague and it's like they've been drinking coffee all day and I haven't seen them touch a bottle of water and they're complaining of a headache. So, eat the fruits and veggies, go to therapy, take your meds, all the things that we're preaching to our patients. We all are patients too. So, I'd be hard pressed to find someone who doesn't have a primary care or a doctor that they see on the regular. So, you got to take care of yourself if you're going to be able to take care of other people. And I think that's...
So you're finding that work-life balance?
1,000%.
How do you do it? What are some of your strategies, if you don't mind sharing?
To be fair, I actually haven't started working officially.
Okay.
I'm in the process of being credentialed at the county, so credentialing for all of my fellow peers is a very tedious process, and it takes quite some time. I'm coming to learn. I actually was hired for the county a few months ago, and I'm still being credentialed, and I probably don't anticipate actually working until closer to March.
Okay.
However, I've rotated at the clinic that I plan to be employed at. I've rotated there. I've actually been there 3 months, so I've had pretty good exposure, and I've gotten to speak with clinicians, and I see the patient clientele, and it's demanding. It is incredibly demanding. Our patients are not, Solano County is not an easy patient population to work with. We're very complex. We've got a lot of patients with a lot of complex issues that just aren't being treated because, primary cares are hard to come by. So that being said, when we do finally get to see these patients that, have all of these issues coming up and we're now handling it, it's overwhelming. And I think work-life balance is honestly going to be a struggle for the entirety of my career. I think that's going to be something I struggle to figure out, but I just honestly am trying to relearn what activities do bring me joy. I think since coming out of PA school, as silly as it sounds, I found myself I didn't know what else to do with my time, so I would just get on my computer and just start going through Rosh Review, which is like some flashcards for the board exam, or, I just watch YouTube videos on different medical things because it's almost all I know how to do at this point. I'm very programmed to just study. So honestly, I am learning my own work-life balance, and I am trying to relearn what even brings me joy. I think I love PA school. I love Toro, but PA school takes a lot out of you and kind of sucks the fun out of you. So, yeah, I just discovered I really like to walk. I don't like the gym. I've never liked the gym. I'm tired of pretending that I want to go to the gym. I don't. But I love walks, and I have actually been able to lose a substantial amount of weight just from walking. So,
Good for your heart.
it's great for your heart. I love podcasts. Didn't know that, but I just discovered I love podcasts. I love true crime podcasts. So a true crime podcast and a nice hour-long walk is amazing. So that's what I do for fun anyway.
Okay.
Yeah.
Stress management.
Ooh, stress management. I do a lot of therapy, walking. I meditate, which is very difficult. Meditating is a very difficult thing. I'm still learning. I have a lot of background noise in my brain, so I am learning how to turn that down, and meditating and just being outside, honestly, has been the biggest game changer for me. Just breathing fresh air, the basics, going back to the basics, getting some sun, vitamin D,
Right.
like things I was seriously lacking in PA school. Very, very basic things that I was
Somewhat
not doing.
regular sleep patterns.
Oh my goodness, yes. I go to sleep at 9 and I wake up at 6. Crazy. It's craziest concept.
Well, I mean, it's like you said, it's an intensive program. It's designed to be that way because there's a lot of material that you need to learn.
Yeah.
And you're going to need that material to serve your patients.
Yeah. Oh, absolutely.
Otherwise, if they could stretch it out for 6 years and it'd be a lot less stressful, right? But then it would take you 6 years to go through the program.
Yeah, and at that point, just go to medical school. Yeah, no,
I think this
absolutely.
is one of, if not the only program in the country that
It is.
that you have to get you get both
Both,
masters.
yep.
Yeah.
Yeah.
If you come here, that's your plan. That's what you're doing.
Yeah. But I would say they do a great job, and they're constantly working on the curriculum. Now that I'm adjunct, I'm on the other side of things, so I have such an appreciation for the way that our faculty just are constantly working through and upgrading their curriculum to be as up to date as possible, and keeping in mind all things public health related. I mean, I am just very, very grateful in retrospect and when I was in the program, but in retrospect especially, now that I've had an opportunity to rotate and work with other PAs or PA students who went to other programs, and it's pretty remarkable how much more in tune we are having gone to this program compared to other programs. So I'm
Sorry about that.
very grateful
Great.
to have had the experience to come here. It's a great program. It is.
So in terms of the fact that it's a joint master's program, how do you envision that the public health master's degree is going to serve your needs as you begin work with Solano County?
Oh, I mean, I was able to witness how it came into play even just through my rotations. Again, when I was working with other students who had gone to other programs, I mean, just the way that we see the patient as more than the diagnosis, and recognizing, for example, I worked with Dr. Schubrook at the county. If anyone's not familiar, he works heavily with diabetes. He's part of the osteo.
Yeah, he's part of COM.
Yes, he's part of COM, thank you. And he was one of my preceptors at the county, and one thing that I thought was just really great about the way he practices, no matter what the patient's situation, whether they express need or not, he will give every single patient that he sees 2 coupons for the farmer's market that's just outside. Because he recognizes that the majority of the patients that he sees, that demographic is, low socioeconomic. And I just think, that in and of itself is huge. Like, that's a huge public health geared thing to be willing to give every one of your patients access to food. When they just came in for an earache or but hey, I recognize that you may also have some struggles at home with food, so here's this. Recognizing, I'm going to give you an extra refill opposed to having you come back in because I don't know if you have reliable transportation. I don't know, you seem to take the bus and the bus isn't very reliable, or you work crazy hours and you have very minimal childcare. Just thinking about the patient in their entirety, recognizing that, what's their insurance? Are they going to be able to afford what you're prescribing? Do you need to make adjustments to what you're going to give them based on the formulary? Just being mindful about more than just, hey, you have this, here's that, and send you on your way. People are multifaceted. There's a lot to us, and so I think that that's something that I have seen across the board, the appreciation that patients have for Dr. Schubert, to just recognize them as more than just the diabetes that they're coming in for today. I'm also going to give you this thing because I know that you have some struggles at home, or you may or may not have struggles at home, and I just want you to know that I see that. I see you. Whether or not you need it, I'm going to provide this thing. I think it's huge, and I think that patients are incredibly appreciative of that, particularly in Solano County. So, that was probably the most eye-opening way that I saw my public health degree being used, was at county in action with the patient population who truly need us the most. I think that was something I didn't see at really any other rotation I had that was outside of the county, and the preceptors who work directly with Toro, who recognize how much we integrate public health. Some of the other rotations I had that don't, they aren't quite, it's not quite as important, I guess, for lack of a better way to say it. It's just really apparent with how they treat their patients and how quickly they're in and out of the rooms, and just how little discussion is had outside of the thing that they came in for, and just really trying to recognize that I see you in your entirety. And even if we can't get to everything, I see that there's multiple things. Let's schedule you for something else. Let's have you come back, because clearly there are multiple things about you outside of your high blood pressure. Let's get into it. You clearly have some psychological stuff going on. Maybe you would benefit from a referral to psych. Again, you didn't come in for a psych-related thing, but as I'm talking to you, I'm hearing some issues that are going on at home, domestic violence type things, maybe something's going on, and it sounds like you may need a little bit of extra help. I'm going to give you this referral. Do with it what you want, but I am telling you that I see there's something going on, and I'm going to take the extra step to do it. That is, if that's not great medicine, practicing of medicine, I don't, that's my standard. So that's what I want to be seen by. That's a clinician I would want to be seen by. So I appreciate that that's the standard that they hold us all by. And we really are we're just better here at Toro University. So.
Well, you've got more tools in your toolbox.
Absolutely. Absolutely.
Better might be that might be a strong term. You're talking about
well-rounded.
You're talking about your peers that got their master's in physician assistant studies or something comparable to that. Right. They don't have the public health master's degree. You do. You've got more tools in your toolbox. Yeah. They may be great PAs, just don't have the same tools in their toolbox, right? You have more tools.
Or as many, yeah.
Or as many tools, yeah.
Yeah.
All right. Well, we're about at our time.
Okay.
I want to thank you, Niki, for joining us.
Thank you for having me.
Us on the podcast here and being here on campus. It's great having you here on campus.
It's cool to be back. I never really left.
Yeah.
I did just graduate in August, so I really never went anywhere, but it's a testament to how much I really love Toro. And if you ever do find your way here, you will find that almost, at least for the PA program, like 85% of your faculty went to the program themselves. Again, a testament to either how much we love the program or how much we can't get enough of the program, or we all have Stockholm Syndrome.
Let's go with the first two.
Yeah. But love it here. Love Toro.
Well, great.
Couldn't imagine myself anywhere else.
Well, again, thanks for joining us.
Yeah,
and to all of you out there, until next time, take care.
Thank you.